Today I'd like to talk to you about the differences between Ayurveda, the energy science that comes from the yoga tradition, and compare that to what we do currently in what is called the allopathic tradition. That is, the doctor you see today, that you talk to about your health problems, he is a doctor who has been trained to look at disease in terms of molecules. So he says, Henry or Mildred, it looks like you've got an abnormal molecule here. Your cholesterol is high, estrogen is low, your molecules are out of whack. And so I'm going to do some things to help you correct your molecular problem. Now, Ayurveda would say, that's well and good, that's a reasonable approach, but it's really, we see disease as an imbalance in the qualities that are present in the body. It's not a molecular science, it's an energy science. And that's a very important distinction between the two disciplines. Ayurveda would say, furthermore, that all disease, and this is a very important concept, that all disease begins at the energy level. It isn't at the molecular level. We have been led to believe a lie that the molecule does the problem, does the disease. It's not true. And it's a concept that we have to begin to understand at a very deep level if we're going to address our chronic health problems of today. The second concept that's very important is that all disease begins at the gut. Ayurveda says that it all happens in the gut. So if our decisions about nutrition are imbalancing, if our decisions about incompatible food combinations persevere, then we will get sick, no question. The third concept is that the energy science of Ayurveda has very strong recommendations with respect to guidelines for lifestyle behaviors. And we really don't negotiate that very well in the allopathic tradition, because we just don't have a foundation. We don't have an understanding, because there is no ground level of tenets that can guide us. And because of that, we tend to say, whatever, doesn't make any difference. From an energy perspective, it makes a world of difference in terms of what will happen to you as you grow older and older and reach those, quote, golden years. Those golden years oftentimes become visits to the doctor from one doctor to another. And nobody really wants to have that happen to them in their lifetimes. But unfortunately it does, and the reason for it is because of all the choices that we've made over decades of our lifetime, making choices that are, from an Ayurvedic perspective, imbalancing. And these imbalances create over time significant dis-ease in the physiology. Lastly, we all look for the magic bullet. We want the one thing that's going to fix it. We want the one magic operation that's going to fix everything. And unfortunately, from an Ayurvedic perspective, there is no magic bullet. I'm sorry. There is nothing that's going to fix the problem. It requires work, it requires discipline, it requires a proactive approach to the disease process that you have. And so Ayurveda offers many, many different tools by which you can gain your health back. But unfortunately, it's not just one thing.